What's the best treatment for lower back pain? Is that tingling in your wrist a warning from your body that you need to see your doctor? Are you eating the right foods every day? When you're looking for answers to your general health questions, just ask Dr. Jim.
Hello and welcome back to another episode of Ask Dr. Jim. We appreciate the viewers that have been watching the show and all the writing questions that we've been getting through our website and through our P.O. Box. So we appreciate that. If you have any writing questions, you can send them to P.O. Box 333, Allamuchy, New Jersey, 07820, and just put attention, Ask Dr. Jim. We'll get them on one of these episodes. The first question of today is, tell me a little bit more about carpal tunnel syndrome and some of my treatment options that are available. Carpal tunnel syndrome is very common these days. The reason is that most of us sit at a desk and we type all day using our hands. The typing position is a slightly unnatural position for the wrist as it's often extended this way, whereas the wrist would rather be a little more flat like this as a natural position. That position puts some extra pressure on the nerves in the wrist, causing carpal tunnel syndrome. If you take a closer look at the iPad here, we'll see in these illustrations on the bottom, the tendons in the forearm go down through the wrist and into the hand. Also lying with those tendons is some of the nerves and arteries that go down into the hands. The most common or most problematic nerve is called the median nerve, and that's the middle nerve, we call it. It goes right down the middle of the tunnel and supplies these three fingers. So commonly with carpal tunnel syndrome, people think any type of tingling in the wrist is carpal tunnel syndrome. The actual real carpal tunnel in the median nerve can only affect these three fingers. So if you're having tingling of these other two fingers, there's certainly other conditions that can cause that, but most likely it's not carpal tunnel syndrome. It actually can't be if it's in these fingers here. So people get these often confused. But carpal tunnel is very common. Again, we put too much pressure on those nerves in the wrist by putting our wrist in extension like this all the time. What happens is by doing that, you put pressure on the nerves in there, causes swelling of the nerves. When the nerves are swollen, we get the tingling in our fingers. This is a pretty big common problem, and there's several treatment options available. Obviously, rest and not using it can be a big benefit, but unfortunately, most of us need to make a living and can't not go to work. So one thing that can be used is the braces. There's special braces or supports that will hold your wrist in the proper position, about like this, a neutral wrist angle we call it, which isn't actually quite even. Your wrist wants to be slightly bent this way, and if you feel that, you'll feel that this position is probably most comfortable for your wrist. Flat is a little bit of pressure, and going up is a lot of pressure. It kind of wants to be a little bit naturally up like this. And there are plenty of braces that can help you hold it in that position. They're highly recommended, especially at night. A lot of carpal tunnel syndrome sufferers will say that they have intense pain at night as your wrist bends in your sleep and pushes against things in your bedroom. It puts pressure on that nerve and can cause the tingling to get worse. Rest and the braces are the most conservative treatment. Unfortunately, it can be a pretty chronic thing, and because that tunnel is so small in there, the swelling can keep coming back and back. So sometimes it needs a little more treatment. And in the worst cases, that includes surgery, but in some of the more mild cases, the common treatments that are used are physical therapy. We can do is work on that area to take away any inflammation, swelling in there, loosen up the muscles in the area, try to give those nerves a little breathing room. Most important thing that needs to be done with physical therapy or other care is that we get rid of the inflammation in there. Now, years ago, the therapy used to be ultrasound for that, and what that did was use a sound wave to get rid of some of the inflammation in there. But the most cutting-edge technology that works much faster is a cold laser therapy. I'm going to show you the cold laser therapy. What it does is shine a light wave in that area, causes the inflammation to rid the area. The other big benefit of the laser, besides just getting rid of inflammation, it actually promotes the nerves to heal. So we all know with nerve conditions, they're much tougher to heal. Everyone's heard of Christopher Reeve or some of these other famous people that have spinal injuries. Nerves are very slow to heal, and sometimes they don't heal at all. So even if we remove the pressure from that nerve or remove the swelling, we can still have years of tingling or months of tingling afterwards as the nerves slowly regenerate or heal. So the laser, in addition to getting rid of the inflammation in there, will help speed the healing of those nerves to hopefully take that tingling down from months to days or weeks. So it's a good therapy for that. If the laser therapy and physical therapy and things like that don't calm it down and the nerve is still being pinched, eventually you have to relieve the pressure from that nerve. And the end route, if these other things don't work, is surgery. You would see an orthopedic surgeon for this. What they do is cut that flexor retinaculum that we talked about. It's a fibrous band above the tunnel. They cut through the skin and cut that band open, allowing a little bit of room left in there for the nerves. Can be effective. It's not the most major procedure, so it can be done pretty easily. Sometimes it doesn't work, just like everything else, but it can be helpful if it doesn't resolve these other type of issues. Carpal tunnel can come back as we reuse the wrist and re-irritate it, but hopefully if you take care of it and watch your workstation, do proper ergonomics and those types of things, you can avoid carpal tunnel surgery. Our next question is from a viewer who's been watching and wanted to know about her grandfather. Said her grandfather was diagnosed with spinal stenosis, wanted to know a little bit more about it and some of the treatment options available to him. Said that their surgeon said he couldn't have surgery done as he's getting a little bit on in the age, and they didn't think it was the best idea for him. So I want to explain a little bit about spinal stenosis and some of the treatment options available. So spinal stenosis can happen at any age. It is very common as we get older. What happens is we have a tunnel here where the nerves come through the vertebrae, and these nerves come out and go to different areas. We're going to concentrate on the low back since 90-95% of stenosis happen in the lower back. So in these bones here, there's a tunnel for the nerves underneath, and the nerves come out and go down to the legs. So as the brain talks to the legs, it sends a message down through the whole spinal cord here, out these nerves and down to the legs. Those nerves fit through a little tunnel, like we talked about, and there should be a nice leeway in there for those nerves. Somehow as we get older, sometimes that tunnel starts closing down on us. And unfortunately, if it gets too tight, it can start putting pressure on the nerves. So that's basically what spinal stenosis is, a tunnel where the nerves fit through. As we get older and older, that tunnel starts closing down on us. If it closes down too much, it'll start actually putting pressure on the nerves in there, giving difficulty with a bunch of activities, most common walking and weakness in the legs. Some of the telltale signs, you'll see patients that slump forward a lot. When you lean forward, it actually opens up that tunnel a little bit, so they'll naturally want to lean forward. A lot of times, in more severe cases, people do have trouble walking. We see quite a few people with walkers or walking around with a walker because they have stenosis, and they're leaning forward and their balance isn't what it's supposed to be. Now, as those nerves are being compressed, the more and more they're compressed, the more and more difficulty we have with the legs, and it can be pretty debilitating as far as even getting into a wheelchair. There can also be the mild cases where it's just starting, and that can have almost no symptoms at all. So it varies quite a bit between just a little bit of a problem to quite a debilitating problem. But it's never a great thing when the nerves are getting impinged in the spine, obviously. So with spinal stenosis, as that canal gets closed down, we want to do as much as we can to keep it open. So some of the treatments you can do, therapy and those types of things, can help the muscles loose and help with the pain a little bit. Can't necessarily help get room open for that nerve. What I tell patients is there's really only two ways to get there more room for that nerve. One is major spine surgery, and certainly in the severe cases that happens. The viewers question about their grandfather. It is a risky procedure. There's a lot of anesthesia. It's a several-hour procedure. And what that procedure is called a laminectomy, and usually laminectomy fusion. And what those big words mean is that the back of the vertebrae here, in order to give more room for the spinal cord, they'll actually cut the back of the vertebrae off and actually take it out of the body, giving room for the nerve to kind of float backwards. So instead of it being a nice tunnel, they're actually taking the back of the tunnel out so that there's room for that nerve to come out. Now, as you can imagine, it's not really so safe to take big chunks of the spine out, so what they have to do to make sure it's safe is put screws and rods in there. And there's other reasons they put rods in your back, but if you've met an older person who had back surgery, this is probably what happened. So they remove the back end of the vertebrae, they put screws and rods in there to make sure it's safe that they can walk around, obviously, without damaging their spinal cord. That procedure can be helpful for people. Obviously, you can imagine a major procedure like that. Stenosis mostly affects older patients. So if you're 70 or 80 years old, going through 8-hour back surgery can be a little risky, and that's why a lot of times they won't do it. The other downside is once you put metal and screws into the body, usually it will develop scar tissue later on, and there'll be other issues post-surgery with patients. But certainly in severe cases, that is necessary. In less severe cases, there's other things available to them. The one major thing that we recommend is decompression therapy. So a lot of people remember back in the 80s in healthcare when we had a slip disc in our back or spinal stenosis, we would do what was called traction. The idea of traction was we would open up this spine vertically. So there was, basically pulleys that hold the hips, another pulley that holds the top half of the spine, and it opens you up. Now the theory is great. You want to open up the spine as it's closing down. The downside we found, they used to put people in traction for 12, 13 hours, a whole weekend at a time. And the body doesn't like being held open for long periods like that. So sometimes the muscles would spasm, or we'd end up causing some issues by doing that with people. So you don't really hear people going into traction anymore. What's replaced is something called spinal decompression. I'll show you a picture of one of the tables here. But what it does is very similar. There's an anchor for the hips, an anchor for the top half, and it slowly stretches or pulls open the spine. The major difference, though, is that it has computer sensors in there to, one, make sure that you're not pulling too hard. So it does a monitored weight. It starts off at a slow pull of a lower weight, and it slowly ramps the weight up over time. So it takes, a few sessions to ramp it up. The other thing it does is it actually pulls for a minute and a half and releases for 30 seconds. So we don't want that sustained pull where it's open for a half hour, but we pull for a minute and a half, release for 30 seconds, pull a minute and a half, release 30 seconds. And it's much more sophisticated, full of computers, so it's much safer than it used to be. And that can help open up the room for the canal. What I tell patients is the difference between this big of a canal where it's rubbing my fingers or the nerves and just opening up this much where it doesn't rub the nerves anymore means you feel a heck of a whole lot better. If you're just touching the nerve a little bit, it causes a lot of pain. The nerves don't really know the difference between a little bit of pressure and a lot of pressure. Either way, they don't like it and it hurts. So if we have a little pressure and we go to just a little bit off there and there's not much pressure or no pressure, you'll feel a heck of a lot better. While that bone is technically still closing in, it takes a very long time for that hole to get smaller and smaller, and if we can delay or keep that open a little bit longer, patients could do much better. Some people that have had stenosis for a while get weakness in the legs, and that's where physical therapy comes in. Our physical therapist here works with the patients after the decompression to make sure that those muscles are strong in the legs. The other thing we tell patients is it's kind of like a water hose coming out of the spine. So there's a kink in that hose, the water's not getting down the legs, like the nerve supply is not getting to the legs. Those legs don't work properly and they need to be kind of retrained and the muscles re-strengthened up. And that can absolutely be done if it's not in a severe case. So that's some of the treatment options available for stenosis. Some of the other things that we'll hear people doing sometimes are an epidural injection. So part of the stenosis is that the nerves are irritated and inflamed. And sometimes what the pain management physicians or orthopedists will do is do a cortisone injection in there. And what they do is just take a needle through the back, they put it into that canal there, shoot some cortisone or steroids in there, and that can sometimes get rid of some of the swelling in there for them. And that can be a great temporary relief. Sometimes it works for a long time, sometimes it's temporary, but it can certainly help out with conditions like this as well. So there's definitely options available to your grandfather besides just surgery. I definitely recommend trying decompression therapy with some physical therapy if it's available, and sometimes combine that with an epidural injection as well to get rid of some of the pain, depending on how much pain and how severe the case is. But just so he knows, there's treatment options available, and we hope he does better. Thanks for your question. Well, our third question is from another viewer. Said that her mother had found out she had a pinched nerve in the neck. Want to know a little bit more about what a pinched nerve was, and again, what can be done for that condition. So pinched nerves are pretty common. It's one of the more common things that we treat in a chiropractic physical therapy office. It's also common to see just about everywhere. And what I tell, everyone's heard of a pinched nerve, knows someone's with a pinched nerve, but really most people don't really understand what it means. So first things first, a little explanation. So we'll start off with the neck here. And what we see is that we have these neck bones or vertebrae here. There's 7 purple ones here, are the neck vertebrae. The green ones are the mid-back or thoracic vertebrae. Now in between each bone or vertebrae you can see these nerves exiting out, and those nerves go to control things in different areas. In the neck, actually the top half of the neck, a lot of the nerves come back up to the head, and the bottom 2/3 of the neck mostly goes and controls things in the arm. Just a little anatomy lesson. So these nerves come out of the spine and they pass through small holes in here called foramen. So the nerve actually started from the brain down through the spinal cord, it comes out to a little hole or foramen in there. Now in the neck we can see that hole or foramen is pretty small, and we can understand maybe how that nerve gets pinched. So to show you a little better, I'm going to show you a zoomed in model. So in this model here we can see the vertebrae zoomed in that we were just talking about. Again, there's 2 bones or vertebrae here. In the back is that spinal cord we had mentioned, and you can really appreciate how it branches off into the spinal nerves, one on each side. So the main spinal cord comes down the middle, and we have a right and left nerve basically that comes out. As those nerves come out, we talked a little bit about that hole or foramen they come out, and this model shows a little more detail. Obviously there's some muscles in there and other things that interact with the area. So what a pinched nerve is that this nerve coming out of the spine is being pinched. And actually a pinched nerve doesn't have to be coming out of the spine. Most of the time that's what people are referring to, but you can actually pinch nerve in other places as well. We'll stick to the spine because that's what our question was about. But as that nerve comes out of the spine, it gets pinched or choked off. Again, the other analogy we like to give is kind of like a garden hose. As a garden hose is coming out of the spine, it's got a kink in it, allowing it to not work properly. Now there's really a few ways that this can happen. The less insidious, more common way that this happens is that these muscles in here just start tightening up. This is stress or tension in the neck, work, sitting at a desk all day, all that kind of things add up. As a muscle pulls tighter and tighter, it eventually pinches or rubs that nerve. Nerves are soft and sensitive. They don't like that a whole lot. So what they do is they start causing pain, getting swollen in there. If we pinch a nerve bad enough, it'll actually start giving us that shooting pain. So how people with a pinched nerve in their neck can often have pain down their arms into their hands even. The more the nerve is pinched, the more swollen it gets, the further away the shooting pain goes. So actually we'll hear patients tell me that, it started in their neck, and after a couple weeks now the pain's in the arm and they don't even feel it much in the neck. And that's a phenomenon we won't get too much into, but something called nerve tracing, where the more you irritate a nerve, the further away from the source you'll actually feel it. And so usually as patients get better, the opposite will be true. The arm pain will start going away and we'll actually feel more neck pain or back pain if it's coming from the neck. So that's a muscular type. The other way you can have a pinched nerve is by injuring a disc in there, and sometimes people call that something different, a slip disc or something, herniated or bulging disc, but this disc can push out and rub the nerve. A lot of the treatment and things are the same, it's just a slightly different etiology or how that came about. So we'll stick to the first type, the more common, less insidious pinched nerve where the muscles just tighten up. So luckily for your family, that's a pretty easy condition to treat. Most cases it gets better with conservative treatment. What I tell my patients in our clinic is that there's really two things we got to work on. One is relaxing all the tight muscles in the area, and two is unpinching that nerve or unkinking the nerve. So as far as relaxing the muscles, what we use is a lot of times a muscle stimulator. Our physical therapist or a chiropractor, whoever you're seeing, has a muscle stimulator. What that does is send electrical signals into that muscle and signals it to relax. What happens when you have one of these conditions, especially if it's been going on a while, is it's kind of like a broken record. The muscle just gets used to being tight, and if you try to stretch it, or you go to massage or therapy and you just try to stretch it, it doesn't stay stretched out because it's just stuck on this cycle of being tight. So many times the muscle stimulator can break that cycle of being tight. It actually kind of pretends to be a nerve and sends an electrical signal in there telling it to loosen up, and it'll retrain that muscle over time. What we tell people is that's half of the equation. So all the time in our clinic we have patients that tried massage therapy, tried other things. If you just loosen the muscle but don't unpinch the nerve, the pain ends up to keep coming back. So we can relax the muscle, you'll feel a little better, but you're going to end up irritating that nerve again. So that's when an adjustment from a chiropractor comes in, and one of our chiropractors will do the adjustment where we take some pressure off of that nerve. Now, people that have been to a chiropractor sometimes get a little scared. We don't take your vertebrae from here to here and all in one day. That takes a few weeks typically. So what happens is each adjustment just moves the vertebrae a millimeter or so at a time to get more and more pressure off of that nerve. As we release the pressure, you actually feel better pretty quickly. Patients will report feeling better after only a few treatments typically as we relieve pressure off of that nerve, but it will take a little more time to really get the vertebrae back where it's supposed to be, in conjunction with other things like the muscle stim and the physical therapy to help work on the muscles and re-strengthen up the area. So good news is if it's properly diagnosed as a pinched nerve, typically that responds very well to conservative treatment, physical therapy, chiropractic, and you should have them feeling better in a few weeks. Of course, some people say it's a pinched nerve and it can be something more serious like a disc issue, and that's something else to get into. But if it's properly diagnosed, pinched nerve should respond very well to conservative treatment in a few weeks. And our next viewer question is from a viewer asked, my primary care doctor told me I had tennis elbow. Please tell me a little bit more about that and what can be done. I've had it for a few weeks and it hasn't gotten any better yet. It's a good question about tennis elbow. What tennis elbow actually means is that there's inflammation in the elbow joint. So if we take a quick look at the iPad here, we'll see that there's some bones in the forearm. There's two bones there, and all the muscles in the forearm go attach on the two ends of the bones. And those two ends are called epicondyles. It's just a fancy word for a bump in the bone. And what it does is all the forearm muscles are attached to that bump, which allows an insertion point or an area for the muscle to pull. So what happens if we use the same muscle over and over again, it keeps pulling on that same bump or epicondyle. And we call it tennis elbow because the tennis players do the same move with that arm over and over again. They use these same muscles, it pulls on the same spot, and it gets swollen or inflamed in there. The inflammation can be painful, and unfortunately it just keeps getting more painful and more swollen because even if we're not doing tennis or whatever irritated it, you're still using it by picking up a pen, typing on our computers. You're always using that forearm muscle, drinking coffee, everything does it. So the inflammation gets in there and it doesn't get out. So sometimes just rest, ice, and some ibuprofen, Aleve, whatever your doctor recommends can be helpful for it, but a lot of times it needs a little bit of treatment because the inflammation just gets stuck in there and it just keeps building and building. So there's a bunch of treatment options available. We'll go from the least to the most invasive treatment. So least invasive would just be icing it when you get home, get rid of the inflammation in there, taking over-the-counter medications. The next least invasive thing you can try before even seeing anybody about it was one of the tennis elbow braces. And if you go to your local Walgreens or pharmacy, you'll see one of these, and it's a black strap, it's typically black, that goes above the forearm here. Now, I see patients come into our clinic all the time with these braces and they're wearing it in the wrong place. The elbow hurts up in here, so they think they need to wear the brace up there. But the whole idea is to give this area a rest and have your muscle pull on a new area. So instead of it pulling on the swollen area, it's actually pulling where you put the brace. So the proper position is below it, about a ½ inch, right in the meat of that forearm. I see all the time people wearing them in the wrong position. Those are very inexpensive, maybe $10 at the local pharmacy. You can try wearing one of those. Sometimes that does give it a rest, absolutely, but it's still inflamed in there. And if we don't do something to get rid of the inflammation, we can still have the problem. So earlier we talked about carpal tunnel syndrome, where there's inflammation in the wrist and it just won't go away. This is very similar just in the forearm. Again, we talked before that the ultrasound was the method of choice of getting rid of the inflammation in the carpal tunnel. As the laser has developed and become a more efficient and better way to do that, we talked a little bit earlier, but 15-20 minutes of ultrasound in the wrist was needed for carpal tunnel or the tennis elbow here, whereas a laser treatment is just 3 minutes or so. The treatment time's cut way down and the healing time goes way up. Instead of 15 or 20 treatments, a lot of times with the ultrasound, the laser might be 10 or 12 treatments, a lot faster healing. The other benefit is there's no goopy gel, and it's a little cleaner and just easier to use as well for the patient and whoever's doing it. So cold laser therapy is one of the therapies of choice. We've seen patients respond that had it for months and 2 or 3 treatments even. It does a very good job at getting rid of inflammation in there and causing the area to heal. The other thing you can do if you're seeing a physical therapist or a chiropractor is do some muscle work on these forearms. If the forearm muscle is still very tight and it keeps pulling on there, even if we loosen up the inflammation in there, if that muscle is still pulling and irritating it, we're going to keep getting inflammation back in there again. So say we did the laser, a few treatments, it felt great, the swelling's gone, but you're just pulling it again at work or driving or whatever you're doing, it's just going to keep coming back again and again, and we're just going to end up in the same thing. The other more fancy way of taping it would actually be using kinesio tape. So if you've seen the athletes on TV with the crazy blue or black tape and really weird patterns, what that does is give a little support to muscles that need it. We can use the tape, we use kinesio tape here, where we actually do the same thing as the band, where we change the insertion point, but further our method, we tape the forearm muscles to take a little stress off them as well to help alleviate the pressure on there. So it's that funny looking tape, it looks silly for a few days, but it works really well at getting the pressure off there and helping the area to heal up. It's special tape if you haven't seen it before or used it before. We put it on in a very particular way, and you must be trained to do it. It actually lasts for 4 or 5 days, and it's waterproof, sweatproof, so you go about your day, and the nice thing is you have support all day. The little straps from the pharmacy are great, but you don't want to sleep in those things. They can cause a problem, and you're probably not going to run 24 hours a day, so they help while they're on, but they're not on all the day. So a lot of times in the office, we will do that taping to take pressure off that forearm for a while. Those things would work. 80-90% of cases will resolve with those treatment methods: rest, ice, therapy, taping, laser. Very few times does that not get rid of the problem. But in the cases where it's real severe and it doesn't go away with those types of things, we send for cortisone injection there. And what they do is just take a needle right near that area, put some steroids in there, which can help knock out the swelling there. It just kind of gets rid of it all in one shot. Of course, if we can avoid cortisone, we always want to do that. But in the severe cases, that happens. But I would say 90% of the time with those therapies, people get better and they go on and nothing really happens back there again. So that's a great question about tennis elbow. Thank you. Next question is about headaches. What are the few different types of headaches, and what are some of the treatment methods available? So headaches can be a very easy or a very complicated issue. There's several different types of headaches. You can go on for hours debating about different types of headaches, different treatment methods. There's really dozens of different types, and a lot of them overlap as well. But we'll go over a few of the most common ones and some of the things that can be done. One of the most common ones, especially in the wintertime now, is a sinus headache. And what happens is the sinuses above and below the eyes get filled with fluid, causes pressure, and causes the headache. And those, again, it gets into a whole long discussion, but the headaches can be relieved several different ways. Sometimes if there's an infection, an antibiotic may be needed. One of the more natural methods that work very well is to do a nasal rinse. The old-fashioned was a neti pot, where you put the saline or salt water through the sinuses to help clear out any infections or clogs. There's a newer product that we like called a nasaline, where it kind of shoots it through with a basically a plastic syringe to clean out the sinuses, and that's in lesser cases. You probably want to get that checked with your doctor first, because if they're real severe and you just go about trying to rinse them out with the neti pot or the nasal rinse yourself, you could actually cause some issues. So you just want to make sure you know exactly what you're dealing with the sinuses. And sinus things can range in all different other types of conditions we don't have time to get into. Polyps, there can be smaller closed canals. There can be all sorts of different things. But if you are having chronic sinus issues, definitely want to get those checked by your primary care physician to see exactly what's going on. But if it's just a typical mild sinus, the rinses and some other treatments can be very good for them. The most common type of headaches we'll talk a little bit more is what we call cervicogenic headache. And there's statistics vary on this, but well over half are this type of headache. And what that means, cervicogenic, is just a fancy word. It means it's coming from the neck. And that's what most headaches are, tension type, stress type. Their doctor word, again, is cervicogenic, just means coming from the neck. So what happens is, if we go back to our trusty spine model here, is that we have the bones or vertebrae in the neck, and there's muscles on either side. There's some big muscles, your trap muscles, which we have. And we see the big muscles that go from the neck down to the shoulder. They're a big part of what goes on with these neck type or tension type headaches. So you can have a 45-minute discussion just on these, but typically what will happen is the muscles tighten up in the back of the neck, and it causes constriction here. Now, the reason this little cutout is shown here is because this is where a lot of the headaches happen from. These three muscles here we call the occipital triangle. Basically, the occiput is the name for the back of the skull. This is the skull bone here. And there's this triangle of muscles in the back of the skull. And right through there is a lot of the arteries that supply the head and the brain. And what happens if there's constriction in there, it can pinch the blood flow that's going up to the brain. So how you'll know if it's coming from here is you'll feel a real tender spot at the base and bottom of the skull. This is right underneath the skull. You'll be very tense right in there. Typically, all sorts of different muscle work can help with that. Just massaging the area yourself can sometimes help. Seeing a physical therapist or a chiropractor, massage therapist to help loosen up the muscles can really help with those types of things. Obviously, alleviating the stress and the tension and what's causing the pulling is going to be a big thing as well. Now, that's a good chunk of the neck type headaches. The other type are just coming from the neck vertebrae themselves. So as the vertebrae are here, these muscles can pull on the vertebrae as well. We see on this side we have the muscles shown that connect, and they can pull on the vertebrae too. And what can happen is they pull so much on the vertebrae that it causes the vertebrae to come out of position and irritate the nerves underneath there. So while it's kind of as similar as the other condition, it is a little bit different where it's actually the vertebrae causing irritation, whereas the other condition, it's really the muscles constricting on the nerve and artery that causes the headaches. And this way these muscles pull, cause the vertebrae to come out of position, and cause the irritation. And the best treatment for that, and that was verified by Duke study, compared all the different treatment options for these types of headaches, tried physical therapy, acupuncture, medication, and chiropractic care. The number one most successful was chiropractic treatment, because the chiropractic allows you to realign the joints and get the pressure off there. Physical therapy was next, and what they can do a great job at loosening up the muscles and things. Sometimes, you need that alignment of the vertebrae as well, and that's why the chiropractic care was a little bit better. And the acupuncture medication were next down the list, is not quite as effective for these headaches. So while you've heard friends popping Advil and aspirin for headaches all the time, if it is this type of headache, the reason why they're always doing it is it's just really masking what's going on. The Advil will make you feel better for a little while, but it's not going to alleviate the irritation of the nerve. So either one of these type of headaches, you really got to get that treated one way or the other. Again, there's several options, but you have to alleviate the tension on the muscle. Some of that you can do at home, but usually by the time you're having headaches like this, you need some treatment to loosen up the muscle. And the second type, where the vertebrae are pulled out of alignment, you actually have to realign the vertebrae to get that pressure off of that nerve. Those are the major types of headaches. Other types of headaches that we'll hear, there's migraine type headaches. Those are more of a blood flow related issue, where there's a blood flow issue with the blood-brain barrier. There's things getting into the brain that shouldn't be. Those get very complicated. And many women will suffer hormonal headaches, and those are actually kind of related, where some of the hormones released in the female body are getting into the brain where they're not supposed to go, causing irritation. There's literally dozens of other different types of headaches, but the cervicogenic or neck type ones are the vast majority of headaches that people have. The sinuses are probably number two, very common. And again, the migraines and the hormonal ones get very complicated, and you do a 2-hour TV show just to talk about those. But hope that answers your question. You really need to determine which type of headache it is before to proceed. If it is the sinus type, you need to make sure that it's not so severe that you might need medication for it. And then if it's not, there's plenty of things that can be done for it. Cervicogenic headache, chiropractic, physical therapy, and massage should usually be able to get rid of those for you without anything too invasive.
Submit your questions by email to info@villagefamilychiro.com or by mail at Ask Dr. Jim, Post Office Box 333, Allamuchy, New Jersey, 07820.